Hey everyone, this is Paul from Ortho Eval Pal. Today I want to talk about 3 tips for plantar fasciitis pain relief. Now, the plantar fascia and plantar fasciitis is a very common area where we have trouble. Many people have problems with the pain in the bottom of the foot. Okay, as you can see here, the most common area of discomfort is heel pain, right in that area. But you can also have discomfort in this band of tissue that goes from the heel all the way to the metatarsals, and it really helps to stabilize this arch. Okay, so a very, very important structure. Now, this structure can become overused probably because you increase some mileage, maybe when you're walking or running, maybe walking on a different surface, changing your shoes. You're at higher risk if you have a very high arch or a low arch. Those will increase your risk. A weight gain can also increase your risk of having plantar fasciitis, and that's quite common. And one of the biggest factors is a tight calf muscle in the back of the leg here. And so in just a little bit, we're going to be talking about 3 different ways that I like to start people for treatment of plantar fasciitis. There are many ways to treatment with soft tissue modalities, physical therapy. There are different things that you can do, such as ultrasound electrical stimulation, radial pressure wave therapy can also be very helpful. But I want to show you some things that you can typically do at home that can be very helpful. Now, don't forget, pain on the bottom of the foot most oftentimes is plantar fasciitis, but you can also have a nerve that's being pinched in this area. You could have a stress fracture to the heel. The fat pad in the heel can become very thinned, and that can cause what we call calcaneal fat pad atrophy, and that heel can cause a lot of discomfort. And then if you're 12, 13, 14 years old, you can have a problem with the growth plate in the heel that can cause you discomfort under here. So there are many other reasons why people can get pain in the heel. I want you to remember that. So now we're going to be on to our 3 my favorite tips for treating plantar fasciitis type pain. All right, now for tip number 1, what I want to do is talk about why we should stretch the calf muscle out. Now, to be honest with you, I do a lot of custom orthotics for patients, and it takes about 2 weeks to have them fabricated. So while I'm waiting for them to get that orthotic back, I teach all of my plantar fasciitis patients to stretch on a slant board, and that's very important that it's on a slant board. I like to have that full contact on the bottom of the foot. Now, why is it, and the other thing too is that before these people come back and get their orthotics, they feel considerably better just with stretching the calf alone. Okay, so it's why I do stretching with almost everybody, unless they have really excellent range of motion. So as you can see here with Maddie, if we straighten her leg out and I push her back, she's got some tightness back here. This calf muscle is pushing or pulling on the back of the heel this way, and the fascia that we just talked about is pulling in this direction on the heel. So they're basically pulling against each other. And when they do that, this big powerful calf muscle overpowers the plantar fascia, and that becomes too strained over here, and therefore gets irritated and inflamed, and oftentimes will also cause the foot to collapse even more. Okay, and every time that foot collapses, it causes some stress to that fascia on the bottom of the foot. Okay, so what we're going to do is we're going to talk about how to properly stretch the calf. So I'm going to have you come right around. We're going to have you put your foot on that board. And as you can see, what we're going to do is we're going to keep the heel down. We're going to keep the leg straight. The other foot stays on the floor. And the hands have to be on the wall. That is very important because a lot of people get onto a slant board and don't put their hands on the wall and just hold themselves there. And that's going to make the muscle contract to help hold them up. Now she's going to use those hands to allow her body to go inward a little bit so that she feels this nice pull through here. We recommend a 30-second hold, and once she's done her 30-second hold, she will step off, take about a 10 to 15-second rest, and or go ahead and do the other leg, okay? So the hold is for 30 seconds. It's very gentle. It should not be painful, but you should feel this nice stretch through here. Most people who stretch their calves on a slant board don't have pain underneath the heel or underneath the plantar fascia. So we do that 5 times in the morning, 5 times at noon, 5 times at night. And sometimes if people cramp up a lot and have Charlie horses in this muscle, right before bed is extremely helpful to decrease those Charlie horses. So stretching the calf is critical, and if it was the only exercise I was going to give somebody, this would be the one. Okay, so now we're going to be on to tip number 2. All right, tip number 2. What we want to talk about is this arch collapsing and using an orthotic to help support that. So every time this arch collapses down like it is right now, the fascia gets strained and the heel comes back. The forefoot goes away from the heel and it strains the tissue under here. All right, so what we want to do, and as you can see, there's a little bit of curvature here, allowing that fascia to drop and get extra stretch in it. So I'm a big advocate of orthotic use, and what we do now is we're going to just take this so you can see. For an example, we're going to put her foot on the orthotic, and now you can see how the inside part of her arch is being supported by the orthotic, and therefore the fascia is not getting so much strain. So if we can decrease the micro trauma to the plantar fascia with the use of a simple orthotic that is adequate to hold the arch up, then that's great. One of the things that we need to be cautious about is getting an orthotic. Most orthotics you get off the shelf will be called a plantar fasciitis orthotic, but oftentimes they're just too cushy and they're flat and they're made with gel and not enough to support the arch. This is a corrective orthotic where we're correcting the arch by holding it up, and it should be worn in a good pair of shoes. So that is tip number 2, and now on to tip number 3. All right, so tip number 3 is something that is very simple to do at home. We know that plantar fascia does get overused, and sometimes it's just too weak to hold up the foot and to hold our body up and to hold that impact when we are walking and running and doing our daily activities. So we need the bottom part of that foot to become stronger and to have some tension put on it. So one of the things we do is something called tension over time, or a little bit of isometric loading. So what Maddie's going to do is she's going to put her hands on the wall. She's going to go up on her tiptoes, just a little bit, just enough to say that the heels are coming up off of the floor, and she's going to hold that for 45 seconds. Okay, so I usually set a timer here. We do 45 seconds on, 45 seconds off, 5 times, and that's once a day. Now, I'm going to have her keep holding here while I chat some more. It's not uncommon to have a little bit of pain in the bottom of your foot in the plantar fascia, where it might be like a 2 to a 4 on a pain scale, of 0 being no pain, 10 being the worst possible pain you've ever had. Now, if it's there, that's okay. If it's there for today, that's okay. But if that pain level gets worse tomorrow, let's say it's a 5 or a 6 over 10 when she makes an attempt to do this activity, then we need to kind of either not go 45 seconds, or we need to do something else like using TheraBand or maybe a machine where we can go less than body weight to load this. Once she can accomplish this, you can go ahead and rest. Once she can accomplish both legs up on her tiptoes, not too high, 5 times 45 seconds, and not have any problems with that for a couple of sessions, then what we do is we recommend going to one leg. So if this is the affected leg, she's going to lift this one up. She's going to go up on the tiptoes here. We try to go for 45 seconds, but if that fatigues your muscle too much and you just can't do it, then you can start with 30 seconds or 15 seconds and work your way up. The goal is to get to 45 seconds here and then go right to 45 seconds here, 5 times on each leg. Okay, once you accomplish that and your pain level has not increased, then we can put this leg down. Then you would go ahead and grab some extra weight and lift this leg and go up onto the heel on that side, and your goal is to try to hold your body weight plus a little extra weight for 45 seconds times 5 and not have any discomfort that day or the day after that. Once you're able to achieve that, you can get into higher level activities such as running or heel raises with more resistance on a machine. And so that's how we would add this loading program. Once your acute inflammation settles down and you're starting to walk without a limp and you're starting to feel a little bit better, we definitely want to get you stronger. So those are our 3 tips for treating plantar fasciitis or plantar fascia related problems. Hope you enjoyed today's video, and give us a thumbs up if you did. Thanks.